Physical well-being is more than just the absence of disease. It encompasses complete physical, mental, and social well-being. It's about having the energy to pursue goals and resilience to bounce back. In Sindh and Pakistan, challenges range from diseases to climate change. Understanding these issues is key to building healthier communities. Physical well-being allows people to work, learn, and contribute. Access to quality healthcare is a cornerstone of well-being. This includes preventive care and treatment for illnesses. Tackling these issues can create healthier communities. Sindh and Pakistan face a growing burden of infectious diseases. Cases of cholera, malaria, and dengue fever have surged, straining healthcare systems. These diseases are linked to poor sanitation and contaminated water. Addressing these factors is crucial for disease prevention. Vulnerable populations, especially children, are most affected. Climate change worsens the crisis, creating conditions for disease spread. A comprehensive response is needed, including international support. Climate change is not just an environmental issue, it's a health crisis. The changing climate is exacerbating existing health problems and creating new ones. Rising temperatures contribute to heat stroke, particularly among vulnerable populations like the elderly and children. Increased rainfall and flooding lead to the spread of waterborne diseases like cholera and typhoid. Extreme weather events such as floods and droughts disrupt access to clean water and sanitation, increasing the risk of infectious diseases. These events also displace communities, forcing people into overcrowded living conditions that further facilitate the spread of disease. Climate change also disrupts agricultural production, leading to food insecurity and malnutrition. Malnutrition weakens the immune system, making people more susceptible to infectious diseases. The interconnectedness of climate change, food security, and health underscores the need for integrated solutions. Investing in climate-resilient infrastructure and healthcare systems is crucial for mitigating the health impacts of climate change. This includes developing early warning systems for extreme weather events, improving water and sanitation infrastructure, and strengthening healthcare systems to cope with increased demand for services. International cooperation is essential for effectively addressing this global challenge. Addressing this crisis requires a global effort. The physical health impacts of climate change are often accompanied by significant mental health consequences. Experiencing extreme weather events such as floods and droughts can lead to trauma, anxiety, and depression. The loss of homes, livelihoods, and loved ones can have devastating psychological effects. Climate anxiety, also known as eco-anxiety, is a growing concern, particularly among young people. The constant barrage of news about climate change and its potential consequences can lead to feelings of fear, helplessness, and despair. Supporting mental health and well-being in the face of climate change requires a comprehensive approach. This includes providing mental health services and promoting coping mechanisms. Addressing mental health needs requires integrating mental health services into disaster relief efforts and providing long-term support for affected communities. Raising awareness about climate anxiety and providing resources for coping with this growing concern is also essential. Building community resilience is crucial for mitigating the mental health impacts of climate change. By fostering a sense of hope and agency, we can help communities cope with the psychological challenges of a changing climate. Section 5. Monitoring and response tracking the spread of disease. Effective disease surveillance is essential for tracking the spread of infectious diseases and implementing timely interventions. This involves collecting data on disease outbreaks, identifying risk factors, and monitoring the effectiveness of control measures. Strengthening disease surveillance systems is crucial for protecting public health. Disease surveillance systems rely on a network of healthcare providers, laboratories, and public health officials who report cases of infectious diseases. This information is then analyzed to identify trends, detect outbreaks, and guide public health interventions. Investing in robust surveillance systems is critical for preventing and controlling the spread of disease. Early detection is key to effective response. Regional disparities in disease reporting can hinder effective disease control efforts. In some areas, limited resources, inadequate infrastructure, and a shortage of trained personnel can make it difficult to collect and report accurate data. Addressing these disparities is essential for ensuring that all communities have access to timely and effective public health interventions. International collaboration is crucial for strengthening disease surveillance and response capacity. Sharing information, expertise, and resources across borders can help countries better prepare for and respond to disease outbreaks. Section 6. Triumphs in Health. The Trachoma Success Story. The elimination of trachoma as a public health problem in Pakistan is a remarkable achievement. Trachoma, a bacterial infection that can cause blindness, was once a leading cause of preventable blindness worldwide. Pakistan's success in eliminating this disease demonstrates the power of public health interventions. The elimination of trachoma was achieved through a concerted effort involving the government, WHO, health professionals, communities, and partners. The SAFE strategy, which includes surgery for trichiasis, antibiotics for infection, facial cleanliness, and environmental improvement, was instrumental in achieving this milestone. This success highlights the importance of collaborative action. Pakistan's achievement in eliminating trachoma is a testament to the dedication and hard work of countless individuals and organizations. It also underscores the importance of investing in public health programs and prioritizing the health and well-being of communities. The elimination of trachoma is just one step towards achieving universal health coverage. Continued efforts are needed to address other neglected tropical diseases and improve access to quality healthcare for all. Building on this success can lead to further progress in global health. Section 7. Vulnerable populations, children at risk. Children are particularly vulnerable to the health challenges facing Sindh and Pakistan. They are more susceptible to infectious diseases, malnutrition, and the impacts of climate change. Protecting children's health requires targeted interventions and a focus on their specific needs. Children's immune systems are still developing, making them more vulnerable to infectious diseases. Malnutrition further weakens their immune systems, increasing their risk of illness and death. Addressing malnutrition through programs that provide nutritious food and promote breastfeeding is crucial for protecting children's health. Early interventions are crucial for healthy development. Climate change poses a significant threat to children's health. Extreme weather events such as floods and heat waves can have devastating consequences for children, leading to illness, injury, and displacement. Investing in children's health and well-being is essential for building a healthier and more prosperous future. Prioritizing children's health is a moral imperative and a smart investment in the future. Section 8. A call to action. Investing in healthier futures. The health challenges facing Sindh and Pakistan require urgent action. We must invest in strengthening healthcare systems, improving sanitation, addressing climate change, and protecting vulnerable populations. Working together, we can build healthier communities and ensure a brighter future for all. Investing in health is not just a cost, it's an investment in human capital. Healthy individuals are more productive, contributing to economic growth and social development. Prioritizing health is essential for building a thriving society. We must prioritize the health and well-being of all individuals, regardless of their background or circumstances. Addressing health inequalities and ensuring that everyone has access to quality healthcare is crucial for building a more equitable and just society. Health equity is a social justice issue. Governments, organizations, communities, and individuals must work together to address the health challenges facing Sindh and Pakistan. By taking action, we can create a healthier and more prosperous future for all.